that start their seasons this fall or training for their respective sports. And we're on your side with information to hopefully prevent some injuries. Dr. Hossein Aziz, he's an orthopedic surgeon at Princeton Baptist Medical Center. He joins us now by Zoom to talk about that. Doctor, good to have you with us this morning.
Hey, good morning. Thank you. Good to be here.
Yeah, it's great to have you. And, you know, there can be some small injuries that can happen that can be nagging, but then there are also more serious injuries like concussions and knee injuries and things like that. What are the most common ones that you see?
Yeah, that's a great question. So, like you mentioned, there's some more sinister injuries and some more common. Some of the most common ones are knee injuries, muscle sprains, ligament injuries. Then you have some more serious ones, like you mentioned, like spinal cord injuries, concussions, and fractures. You know, with fall coming right around the corner, it's a sport-heavy season. There's always potential for injury anytime these athletes are taking the field. We
know these training staffs for all these sports teams, they had really advanced in the last couple of decades. But what are some other good ways that parents can advise their kids about preventing some of these injuries? Let's start with ankles, maybe move up to the knee, and then obviously concussions.
Sure. So that's a great question. Overall, whether ankle, knee, elbow, shoulder, the biggest thing that we found recently is to avoid single sport training. So what does that mean? Avoid playing the same sport the whole year round, especially for children under 15. That tends to cause a lot of overuse injuries, whether it's the ankle, whether it's the knee, whether it's the shoulder. So cross training is huge. If your child, your athlete is a baseball player, have them train for other sports in the off season, not just for baseball, and try to take at least a month off away from that sport to cross train, at least. With respect to the ankle, one of the biggest things to prevent injury is maintaining the flexibility of the ankle, stretching, and strengthening. With respect to the knee, making sure you've got good quad strength and good coordination, especially for young ladies that play basketball.
Yeah, that's what I'm being advised to do, by the way, and I'm much older than obviously these students is to, I had meniscus knee surgery, and so I'm being told to strengthen that quad, Mike. Hey, let me ask you about this, though. We see advertisements on social media, you may see it on Amazon, for certain kind of, those knee bands you could wear, also some knee braces and ankle braces. How effective are those in preventing injuries?
Yeah, that's a great question. Unfortunately, there's no magic bullet, whether it's bracing or those small little bands that you're referring to. But kind of the key, in my rule of thumb, is if it feels good and you feel like it's helping, then go ahead and wear it. For some folks, it just keeps a reminder for them to be careful with certain activities and certain motions, and that's great. And while it hasn't been proven to help prevent injuries, if it helps serve you as a reminder and it feels good, there's no harm in it.
Yeah, there may be some parents on a budget who say, should I buy that, should I not? That's good advice for them. Finally, we could spend a lot of time with this. We only have a short period of time. But the most common way you're going to treat injuries that aren't as severe where they need surgery?
I'm sorry, what was that?
The most common way to treat injuries that are not as severe that where they would need surgery.
Yeah, so that's a great question. The classic RICE, so rest, icing, compression, elevation is key. Working with your trainer. The trainers are excellent, especially for on the field injuries, following their advice and not rushing back to get into play. I know a lot of times there's some pressure to get back on the field, but just kind of taking it back and waiting till you're pain-free to return to play.
All right, that is Dr. Hossein Aziz, an orthopedic surgeon at Princeton Baptist Medical. Thank you, doctor. We do appreciate it.
Thank you. Appreciate it.
All right. Mickey knows a little bit about